Charting the Citizens Political Reporter. Today's guest is Bill Hammond, Senior Fellow for Health Policy at the Empire Center. Bill has been at the forefront of efforts to obtain the true number of COVID-19 deaths involving New York's nursing home residents. He joined me to discuss that data, why it's important to have that information, and what the lessons should be based on how the pandemic affected skilled nursing facilities. Bill, with the COVID-19 situation in nursing homes, I say situation broadly because there's a lot of different parts of this, but in your capacity at the Empire Center, when did this really hit for you that this was going to be the long-term problem that it is, not only with obviously the toll that it's taken, but specifically with something I know that you focused a lot on, the state's withholding of certain data regarding those nursing home deaths?
Well, I mean, like everybody else, I was following news, and it dawned on me at some point in March probably that, wait, I'm a health policy guy and this is a health crisis. I need to pay attention to it in a way, and I think actually my way of paying attention to it was to gather data and crunch the numbers and try to figure out how they compare to other places. And for a while, with respect to New York State, I was one of very few people who was doing that. But now I feel like just about everybody has their own little spreadsheet that they're keeping, and they're following numbers the way they want to follow them. So, like everybody else, I was watching the gubernatorial briefings. I was stuck at home. I'm watching them on the computer. And so, reporters started asking about nursing homes, and data started coming out. There was a lot of attention to the March 25th memo, which required nursing homes to accept coronavirus positive patients for a period of several weeks. And then there was discussion about the data and what was missing from the data. So I was just kind of following it the way everybody else was. I'm not even sure I wrote about it that much at the beginning. But then it became increasingly clear that the governor and the health commissioner did not want to talk about that, did not want to give the information. They were holding back information, and they were using the partial information they gave out to make claims about New York and how it compared to other states. It's one thing if you're having trouble gathering the data, or if you have some reason for not releasing the full data, you should, and then somebody asks about the issue, you should say that, we're not in a position to release the full data right now. But instead of saying that, they would say, this is all just a political hit job, and in fact, we're the 46th best state in the country. Like, nobody's better than us. And so that, as somebody who cares about the use of statistics, that irked me. And then I was watching the hearing where Commissioner Zucker was asked about this issue. It was in August. It was on August 3rd. It was already several months into the crisis. And a bunch of legislators from both parties were asking, why aren't you telling us the full count in nursing homes? And he didn't have an answer. Not only did he not have an answer, he didn't have a good explanation for why he didn't have an answer. It was really remarkable. If you go back and read the transcript, it was vague and evasive and unpersuasive, and there was no sense you were ever going to get the truth. He vaguely said, oh, I'd love to give you that, I'm going to work on it, but there was no deadline or anything. And that's when I said, okay, I should foil this. Just to start that ball rolling, because as you know, it takes a lot of time. So that was August 3rd. And I got, you get the instant response, which is basically, we received your letter. And then later in August, I forget the exact date, I got their formal response. And it said, we are conducting a diligent search for the records. We'll get back to you on November 5th. And I think that is when it dawned on me, they're playing games with this, but I have an advantage over them because the law is on my side. And I wrote a blog post about that letter and about how I didn't think it was true that they were conducting a diligent search. I had reason to believe that they knew exactly where the data was. The commissioner just talked about it in a legislative hearing. I knew that the nursing homes were required to report the data I was looking for on a daily basis. I knew the health department was compiling it, and I knew they were posting parts of it. So it didn't make sense to me that they had to do any kind of search at all. And so in addition to blogging about it, I appealed. I wrote one of those internal appeals that you can do under FOIL, knowing that they would reject my appeal, and then knowing that that would give us grounds to file a lawsuit. and it took a number of weeks before the appeal unfolded and we got our papers together. We filed the suit. But again, I was really confident that ultimately the law was going to be on our side. It seemed like such a clear-cut case. The advantage that I had that most people in this situation don't have is I had access to a lawyer. You know, it's part of the Empire Center's mission to promote transparency. And we have a relationship with the Government Justice Center, which is a public interest organization that does legal stuff. And there's a lawyer there named Cameron McDonald. And I knew I could go to him with this case. He would decide whether it was worth pursuing, but money would not be an issue in this case because that's part of our mission. And that made all the difference because this was such a clear-cut case. It was so obvious that these were public records that I was entitled to. It was just a matter of getting in front of a judge and then waiting out the process. And because I had access to a lawyer, I could go that route. I hear all the time, and I've experienced it myself, from reporters who do a FOIL and they get a deferral letter and another deferral letter and another deferral letter. And each one puts it off 7, 8, 9 weeks. And that adds up to months, and then it adds up to years. And there's really no way of cutting it short unless you're willing to go to court.
You know, I think it's been overshadowed a bit by the recent developments, but that lawsuit you speak of was successful. So, you know, what was the data you received? And obviously this all happened, I think, with obviously the release of the Attorney General's report happened around the same time, if I recall the timeline correctly. And then
yeah, so they had deferred me after November 5th. They had deferred me to January 13th. And at that point, the judge had been reviewing the case. She'd had the papers. We were waiting for her decision for a couple of months. And I think, I'm just guessing here, but it's possible that in the back of her mind, she was thinking, I'm not going to have to rule on this because on January 13th, they're going to give them the data. But on January 13th, they gave me another deferral letter, and this one to March 22nd. And I think that sent a very powerful signal. They had no intention of ever releasing this data unless the court ordered them to. So that was January 13th. Then January 28th, I believe it was, out of nowhere, the Attorney General releases her report. And the bombshell revelation in there was the governor is underreporting deaths. But of course, we all knew that. We knew that there was a missing segment of deaths. She quantified it. She went to a subset of nursing homes and tracked down the best numbers she could find and said, it looks like they're underreporting by 50%, which put another way means they're leaving out a third of the deaths. And that kind of forced the governor to respond. And they finally gave a total number of nursing home residents who had been transferred to hospitals. I don't know if we had discussed this earlier, but that's what they weren't giving out. They were reporting the number of nursing home residents who died physically in the homes. But if they got sick and went to a hospital while they were sick and then died in the hospital, that was not being reported. And it turns out that was about a third of all the deaths. So finally, the commissioner says, okay, it's about 4,000 people. So they had been reporting 9,000, and now we're up to 13,000. And that was catalyzed by the Attorney General's report. The following Wednesday, a few days later, February 3rd, the court rules in our favor, unequivocally. The Empire Center is entitled to this data. You're in violation of the Freedom of Information Law. Report it to the Empire Center within 5 days, and by the way, pay their court costs. So it was just like it was exactly the ruling we had hoped for. They had 5 days to report it. Over the weekend, they updated the numbers on their website to reflect a new total, which, in addition to the 4,000 that they reported in nursing homes, there was another 1,500 in adult care facilities. And so now the total, which had been 9,000, is up to 15,000. And then that still left them a few days. We had asked for, in addition to the totals, we had asked for a day-by-day count in each facility. That's a lot of data. It's thousands and thousands of data points, but it was going to be in a spreadsheet so that we could really analyze when things got bad, when things got better on a facility-by-facility basis. That was the deadline for that was Wednesday, February 10th. And they told me I would get it by close of business. So it's 5 o'clock on Wednesday, and I'm sitting at my computer hitting refresh on my email. Little did I realize that at that very moment, Melissa DeRosa was sitting in her meeting with the members of the legislature, and Howard Zucker and a couple other people were there. And she was making her controversial statements about admitting that they had withheld the data, indicating that the reason they withheld the data was because they were worried about the political implications and whether, the feds would use it against them, was the phrase she used, which was not consistent with what they had been saying up until that point. They had been saying, we're worried about double counting. We're auditing the data for correctness. We're trying to reconcile it. We're reviewing it for privacy issues. We're searching for the records. Like, they said all these things. They never once said, yeah, we can't give it to you because we think it'll be embarrassing. Or that our political enemies will use it against us. At any rate, when that meeting was over, or around the time it was over, the email arrived in my inbox, and we posted it on the web, and it's there now at empirecenter.org. The health department has not posted it on the web, by the way. And we're looking at it to see what it says. It's a pretty big data set. It's complicated, and we're crunching the numbers to figure out, does it have anything to say about the March 25th memo? Does it indicate whether that policy made things worse or not? So that's what we're trying to figure out.
With you mentioned Melissa DeRosa's comments, and really the world learned about this through a New York Post story that broke, I believe, on Thursday about that meeting, and it was a bombshell. I think it's fair to say, because of just especially how that has played out over the last several days, and as we're recording this, it's Tuesday. Just yesterday, the governor offered a further explanation. I think it's fair to say, it certainly wasn't an apology, but explained their actions a little bit more. But what did you make of her comments and the governor's explanation about withholding this data? Because, as you point out, there was a different explanation offered, months ago when they were saying, oh, it's, auditing and other things. And now they're saying that it was essentially withheld so that Donald Trump couldn't use it against them.
Well, I had two basic reactions. First, that's quite a confession to make, that you are withholding public information, not just from the public, but from members of the legislature, committee chairs and your colleagues in state government, allegedly a co-equal branch. You're withholding it not for some high-minded reason, but because you're worried about how your political enemies will use it against you. It was quite a confession, and maybe even, you hear people say that sounds like obstruction of justice. I think it could be read a couple of ways. I'm not ready to accuse anybody of committing a crime, but it sort of flirted with the concept of obstruction of justice. And so she's making this kind of incriminating comment, and it wasn't true. Or at least I didn't find it convincing, because the Department of Justice, she referred to the inquiry from the Department of Justice. That didn't happen until late August. At that point, they had already been holding back this information from the public and the legislature for 3 months or more. So maybe the concern about the Department of Justice would explain why they were holding it back in late August and September, but it doesn't explain why they were holding it back in May, June, July, and early August. So I didn't feel like, as self-incriminating as it was, I didn't feel like it was yet the bottom line truth. As you mentioned, the governor talked about this yesterday. There was a period of 5 days where he didn't have any public availability where the press could ask him questions. Yesterday was the first chance. He didn't submit to a lot of questions, especially he didn't submit the questions from the Capitol Press Corps, who would be most interested in that, what happened with Melissa DeRosa. In fact, he was never even asked to explain what Melissa DeRosa said. He had his own explanation, which was, we got this inquiry from the Department of Justice. We told the legislature we were going to put their request on pause while we answered the Department of Justice. And then the coronavirus came back and we were too busy. That's their new explanation. Again, does not make any sense. The Department of Justice inquiry was not an exhaustive thing. I believe they responded to it within a matter of a week or two. It involved a relatively small number of nursing homes. It certainly doesn't explain why the health department couldn't make a copy of a spreadsheet and send it over. And that was dealt with in early September. The virus didn't start getting bad again until late October and into November. I just, it just does not sufficiently explain their utter radio silence on that issue. And especially it doesn't explain why in January, with a lawsuit pending, that they would defer it to March. That's not the legislature, that's me. But by the way, the legislature had sent them a long list of questions. It wasn't just about nursing homes. They had asked those questions in early August. And here it was February, and Melissa DeRosa was saying we were too busy with the Justice Department, or the governor saying we were too busy. This is a 6-month period. The state government has to be able to walk and chew gum at the same time. And So I don't think anybody, actually, I don't think anybody in the legislature accepts that explanation, and I don't.
I know in covering a nursing home outbreak locally that those hospital numbers were important because it told the full story. We had an outbreak that if you went off the state numbers with just those who died in the facility, there were 48 deaths. It turned out there were 9 more who died in the hospital. So it not only helps tell the full story, but I think, and this gets to my question that I want to ask, is how this is and why this data is so important in really examining this full, crisis and really trying to develop solutions for the future to prevent this from happening whenever the next pandemic arises.
Yeah, so that scenario you just said where they had 48 and it turned out there were 9 more, that's kind of on the low side in terms of the average. The average would have been they had 48 and there were 24 more. And there were some homes that had even higher numbers. So I think just the totals tell a story. They tell a story that about a death toll that instead of being 9,000, it's 15,000. You might say, well, they're both horrible numbers, and they both are horrible numbers. But back when it was 9,000, you could compare that number against the numbers in every other state, and you'd see, oh, it looks like it's below average. Now that it's 15,000, it's no longer below average. We had one of the worst nursing home outbreaks, along with having one of the worst any kind of outbreaks in the state of New York. So you keep, there's no room for complacency about it. The legislature is already responding with, I would say, a greater sense of urgency, given how much worse things turned out to be. You've also, we had a second outbreak. In the period when we were waiting to get the accurate count of how many people died in the first outbreak, we had a second outbreak. And it might have helped had the public been more keenly aware of how severe that first outbreak was. And it may have led to people being, marginally more cautious before the second outbreak. I think the people in the nursing home industry were keenly aware of how dangerous the virus was. And I don't think there was any complacency on their part or any, there may have been some, but I don't think, a higher death toll would have necessarily changed that. But I think our whole mentality as a society would have been more attuned to the seriousness of it. We're talking about roughly 1 out of every 7 nursing home resident died from this one disease in the space of less than a year. And by the way, they're still dying, although thankfully we're on the downslope of the curve at this point.
With the March 25th advisory that went out, because I think that was certainly an important point too. I remember doing a story back in April, and I interviewed Stephen Hands with the New York State Health Facilities Association, and he talked about really a confluence of issues affecting nursing homes, and one of those was the March 25th advisory. Based on that guidance, and there was actually a story by the Associated Press that came out the same day as the New York Post story about how many residents, I think it was close to 9,000, that were, went from hospitals into nursing homes. Based on the numbers that we see there, I mean, how big of a problem was that for nursing homes when they're already dealing with so many other issues, staffing and low supplies?
Well, so if you go back to the history of that order, nursing homes were pretty vocal about the fact that the governor and the health department did not consult them before issuing the order. Excuse me. If they had consulted them, it's pretty clear the nursing homes would have said, you must not do that. That would be a bad idea. People are going to die. And the reason I know that is because there was an organization of nursing home medical directors who had taken that position publicly before the governor did it. They saw this starting to happen in other places around the country, and they said, no, stop, don't do that. That's the worst thing you can do. People will die. I mean, it was that explicit. And so the state issued this order without giving even a heads up, let alone getting an opinion back from the nursing homes. There's been a report that it was inspired by a request from a hospital organization, the Greater New York Hospital Association. That's, like that was reported by a newspaper. I think it's a solid report. I think it's accurate. It hasn't been denied, but it's not like clearly in the public record that that's what happened. It is clearly in the public record that the nursing homes say they weren't consulted. And so think about the situation they were in. Many of them had outbreaks already. They had shortages of PPE. They had staff calling in sick. If they were in New York City, especially, they were under siege. And to be told, okay, now you have to take a bunch more patients who are coronavirus positive. Again, this is on the public record. There were nursing homes that went public at the time and said, we can't handle these patients. Please don't send them to us. Why not send them to the Javits Convention Center where they had a temporary hospital set up? Why not send them to the Navy ship that President Trump had sent to New York Harbor? So at least some homes were pretty vocal about objecting specifically to accepting any positive patients at all. The governor, oddly enough, has said on the record, first of all, he says they weren't forced to accept patients, which the nursing homes would dispute. And he's also said it never happened that a hospital was forced to discharge a patient into a nursing home. And that's quite a bit of sophistry there, because what he's saying is the nursing homes never exceeded their capacity. Despite fears that it would happen, they never got to the point where they were absolutely full. So they never had to empty beds by discharging positive patients to nursing homes. Whether they had to or not, they did. And that's documented. The state had already had documented over 6,000. We now have a FOIL that the AP filed that shows it was over 9,000. So there again, the state was underreporting a relevant fact. So it was a consequential thing to do. I think I've always thought that like the outbreak was so severe and the virus was so prevalent, especially downstate, that I didn't think it was fair to say that order was solely or even primarily responsible for how bad things got in the nursing homes. It was going to be bad in the nursing homes with or without that order. I do think that the order made things worse. Certainly there are individual nursing homes who would tell you that they were already stretched to the limit, and they were, if nothing else, they were asked to take on more responsibility and also the risk of exposure to other patients. Exactly how much it made things worse is going to be very hard to pin down, because you're talking about one of hundreds of factors that were driving a lot of infection and a lot of deaths in nursing homes. How are you going to tell if it was that order or the lack of PPE or a shortage of staff or something else?
I wanted to close with a couple of questions. One is, with the Attorney General's report that came out, and that was the product of a a preliminary investigation. There's investigations ongoing into, I believe, over 20 nursing homes, she said in that report. But there were a lot of findings beyond the data and the different government orders. It related to the access to PPE, which was lacking, testing, and then staffing levels too. I mean, these are. I know I just did a report on a story on a local hospital that has a nursing home also, and the nurses talk about how these staffing issues have been longstanding problems. They predate COVID. So where does the state, you think, need to focus its attention, going forward on these healthcare systems, specifically with nursing homes? Because, I know that there's talk of a funding gap, but also, should there be mandated staffing levels for these nursing homes that have those problems?
Well, I agree that there are a lot of underlying conditions in the nursing homes that probably contributed to how bad things happened. I mean, it was bad in every state. Everywhere that had coronavirus, it was bad in nursing homes. So I don't think we should assume there was anything particularly unique about New York's nursing homes. It does seem like their infection control practices were not up to par. Certainly that's been a complaint from nursing home watchdogs going back years. And that is something the state definitely should look at. Staffing does seem to have been an issue. The Attorney General highlighted that. I'm not sure that setting statutory staffing levels in law is the right way to go. There could be unintended consequences from that. I mean, when a nursing home runs short of staff, their solution often is to hire a temporary person, and the temporary people work in multiple homes. And I believe there's some concern that they became carriers. So they worked in a home, they were exposed to a patient, maybe they weren't even aware of that. Then they go to another home and they bring the virus with them. And that kind of activity, if you have a staffing minimum, that you're going to do, you might need more temporary staff in a pinch. That's another thing that happened is that there was pressure on staff to work when they were sick or when they'd been exposed and they weren't sick yet. That's technically against the rules, but when you're short of staff, that's the kind of thing that happens. You pressure people to work when they shouldn't work. Again, that could be an unintended consequence. If you ratchet up the pressure on that one issue of staffing, and they face consequences for falling below a certain number, you might see them resorting to desperate measures to stay above that number in a way that's not necessarily in the best interest of the patients. So these are things to think through. It's not necessarily a reason for completely blocking the whole thing. I would, as a matter of background, I would say that New York State spends a lot of money on nursing homes, spends a lot of money on long-term care in general. We have an absolutely massive investment in home-based care for the elderly, and for some reason that has not resulted in lower costs for nursing homes. So I would be cautious about saying that nursing homes are underfunded as a general rule, because there may be situations, there may be certain homes that are underfunded, there may be certain activities within nursing homes that are underfunded. But as the Attorney General pointed out, there are opportunities for nursing home operators to siphon money out of the system. And that seems to be happening, and that deserves to be examined too, even though it's not directly related to, controlling or preventing a pandemic. We can't afford to be wasting, we can't afford to have money that we're investing in this very expensive care go to waste. So we are a high spending state, and I really think that our first approach should be, let's get better bang for our buck, instead of just assuming that the answer is spending more, because that's kind of the pattern in Albany is when something is wrong, the people who provide the service say, well, you're not giving us enough money. The legislature gives them more money, and things don't necessarily improve. I think they should rethink how they regulate the homes, how they finance the homes, how the homes operate in general. And it's a huge and complicated issue.
Yeah.
And it's
Yeah.
kind of overdue for an in-depth examination. And so it's a little distressing for me to see the legislature already rushing to pass bills. These are bills that have been sitting around for years. They don't reflect any particular examination of what happened in the past few months. And they fall along the lines of, we think we're not spending enough on nursing homes, so let's spend more. Or we think they need more staffing, so let's require them to do more staffing, instead of some kind of really in-depth analysis of where things are going wrong.
Should there be an investigation, full investigation, whether it's by the Department of Justice, the U.S. Department of Justice, or maybe the State Attorney General's office does an extended investigation? There's been calls for an independent investigation. What are your thoughts on something like that to look into this matter, as a whole?
There definitely should be an investigation. One concern I have is it will be overly focused on the governor and the controversy of the moment, which is a serious controversy. It deserves examination, but it's a small part of the big picture. The analogy I've been drawing is to a plane crash. The National Transportation Safety Board, one reason we have such safe air travel is because the National Transportation Safety Board, when they go in and examine the crash, they're not looking to pin blame on anybody. They're looking to understand what happened, and they're looking at the systems around it and all of the different factors and how those factors play together, and how they can build a better system that will prevent the next accident like this one. So they look, pilot error is one of the things they look at, but they also look at, what were the weather conditions? Was the equipment in good shape? Had it been properly inspected and maintained? And also, by the way, they don't just go in and assume, oh, we need to pay higher airfares. That's the last thing on their list. Sometimes there is pilot error. Sometimes but the answer isn't just put that pilot in jail. The answer is, how do we make sure that the pilot doesn't make that mistake again? How do we make sure he's awake? How do we make sure he's not drunk? How do we make sure he has the right instruments in front of him, that he's in communication with the tower? I mean, this is an extended analogy, but I think a lot of it applies here. If the governor made a wrong decision, what are the factors around that decision? What are the protocols that he followed? What protocols should be established that he has to follow in the future? Excuse me. So the next question is, who can credibly do that investigation? I mean, the huge problem we have right now is that the governor and the health commissioner, the two people who would normally take charge of something like that, who might even lead the way and call for it, they're in a mode of being defensive and withholding information. And the last thing they want is an in-depth investigation. The legislature also seems to be shy about it, because it would mean them going to war with the governor, and they have a state to run. I wrote an op-ed in the spring that said, I thought a bunch of prominent, credible civic groups should get together, form a kind of coalition, and share the work amongst them. It didn't come together. It was kind of a pipe dream. I'm not really sure what the answer is. It's conceivable that the governor and the legislature would get together and they create some kind of commission and they give it a lot of independence, so that it could ask the questions that the powers that be aren't really interested in answering. But I think you can recognize just from the way I described it how tricky and unlikely that is. So it might have to be, as you suggest, it might have to come from the federal government, because um, for the state would essentially be investigating itself, and the state's not good at doing that. I mean, there are states that do it and do it credibly. New York has had an issue of not being able to do that.
Plus, you think with the federal government, it would look, at other states as well. I know that you mentioned, this wasn't just a New York problem. This happened in virtually every other state. So, with a federal review, it seems like they would look at the bigger picture instead of, to your analogy with the NTSB, instead of looking to pin blame on, one person or a few different people, to look at, what the problems were and how to fix those in the future.
Well, there certainly were some problems that were common to all states. New York had it worse. And I think part of that is because of the physical nature of New York City in particular. It's dense, it has a subway, has heavy tourism. These are all things that are actually considered its strengths normally, right? And they suddenly become huge liabilities in the context of a pandemic. So that's part of the reason why it hit us so hard. And so we have a special responsibility to be that much better protected, because it can go so bad so fast. I guess another point I would make is that public health is traditionally a local and state responsibility. The federal government is playing more of a role over time. The CDC is kind of the world's gold standard, at least it has been. But technically, in many respects, it's an advisory agency when it comes to decisions that the state makes. The state has the final word. And sometimes the state delegates that down to the county level. In as much as the state is really the sovereign operator when it comes to public health, I think the state needs to clean up its own house. And it needs to, there are unique conditions. And the tension, one thing that we really need to address is the tension between the governor and the mayor. I mean, if there was ever a time when they needed to work together, it's when there's a disease that's killing, thousands and thousands of New Yorkers. They can't be feuding in that situation. And yet it happened this time, just as it always seems to happen whenever there's a crisis. I don't know what the solution to that is, but that's a unique thing, because most states don't have a city like New York that could be a state all on its own. It's so big, and it's the economic engine of the whole state. It's a major economic engine of the country. It has a very expansive local government infrastructure. No other state is in that position, and it became a factor during the course of the pandemic. And so I'm not sure the federal government is really best positioned to address that kind of a thing.
Thanks again to Bill Hammond for joining me on the podcast. I hope that interview was insightful for listeners. It really covered a lot of ground about the situation in nursing homes through this pandemic. It's nothing short of tragic what's happened. And there's going to be a lot of discussions going forward about how to plan for the next pandemic, because as we've seen with this one and prior pandemics, it will happen again. How will we prepare for that? What are the lessons from this one to prepare for the next one? And certainly the lessons that we've learned the hard way, really, with nursing homes will be part of that going forward. So I appreciate Bill taking some time out to discuss everything with the data and just nursing home policy in New York. He's a great mind to tap into for these kinds of issues regarding health policy in New York. So I appreciate his time. With that, I did want to discuss something before we wrap up the podcast. I will have a few guests coming up. I'm actually going to post a couple of podcasts next week because I do have a bit of a backlog. So Next Wednesday, I'll have a doubleheader. That podcast will feature two guests. One is Justin Wilcox, who's the executive director of Unshackle Upstate. The other is Joe Wazinski, who's the new president of the New York State County Highway Superintendents Association. Nailed that acronym on the first try, which is good. But they joined me to discuss different things. Justin Wilcox from Unshackle Upstate talked to me about Unshackle's 2021 advocacy agenda. So there's a lot of different issues they're focused on this year, and they hope that the legislature will focus on those same issues and tackle some of those, tackle that wish list of sorts. With Joe Wazinski, talked about the issues affecting county highway superintendents across the state, whether it's funding for bridge and road repairs and COVID-19. At the time we talked, there was real concern about access to the COVID-19 vaccine for highway workers, but also just how the pandemic has affected highway workers because, like so many others, they're frontline workers too. So an interesting podcast, I think, there. I decided to put those together because really it all comes back to state government, different issues within state government, but still. And I thought packaging them would be, for the best. That way I could fit these in because I do have a backlog that's growing. So special podcast on Wednesday. We'll stick with the Friday lineup. But on next Friday, Dutchess County Executive Mark Molinaro will join me. This was a great chat about how local government has dealt with the COVID-19 pandemic. And Molinaro, as a county executive, has seen this up close. They've been dealing with it every day. We've seen that in Central New York with Onondaga County Executive Ryan McMahon, and how these county leaders have, this has consumed their schedules. Yes, there are other things that come up. Certainly this time of year you have winter storms, but COVID-19 is certainly at the forefront still, especially now that you have the vaccine in the fold. That's a priority for them too, to get that into as many arms as possible. So we talked about that. We also talked about his political aspirations because 2022 is coming up. Obviously next year, it's a gubernatorial election year. Will he run for governor again? Pose that question to him, and he does have an answer. So you'll hear from him next week about that. In terms of other issues to discuss, I did want to point out, kind of piggybacking on what the main interview was today, about the nursing home deaths. As I record this, Dr. Howard Zucker, the state health commissioner, has just testified to the state legislature about really the health portion of the budget, but certainly what happened in nursing homes was a major theme, I would say, of the questions asked by several legislators. Different types of questions too. It wasn't just all about the deaths and the numbers and how that data was handled, but there were questions about the March 25th advisory, which you just heard from Bill and I. We talked about this during the interview. That, of course, was the advisory dealing with telling nursing homes that they could not deny admission or readmission to people solely because they had a confirmed or suspected COVID diagnosis. There was also a piece in there that they couldn't be tested. These residents, they couldn't be tested before being admitted or readmitted. So that was part of it, but there was also a lot of talk of nursing home policy in New York. There's been some reforms proposed. What direction should we go in there? So a lot to really digest with this because, again, yes, you're starting with a number of people who died, well over 10,000 people, over 13,000 people in nursing homes. But there's also, the aftermath of that. Obviously people are grieving, but then you have the reality of how did this happen and what do we learn from it and where do we go from here? And in my experience covering the story, because we had an outbreak here in Cayuga County, so I've covered this from a couple of different angles. I've covered it from the state government piece of it and the different policies there, but also at a hyper local level, how an outbreak like this has played out in a community. And with what I saw during that story, the local outbreak we had here, is that it really kind of opens your eyes to some of the long-standing problems that have been affecting nursing homes, whether it's staffing levels, resources that were available, how they implemented and put into action infection control protocols. Many of these things, by the way, were mentioned in the Attorney General's report that came out in January. That report gets a lot of attention because of how it scrutinized the State Department of Health's data and how they disseminated that information. It also scrutinized some of the regulations, including that March 25th advisory I mentioned, but it also gets into the nursing homes themselves and infection control protocols and the personal protective equipment available, testing, many of these things. So this isn't just about this one piece of it. There's been a lot of attention on the data, and rightfully so, because of how that was handled by the Cuomo administration. It was handled poorly. They acknowledged that. But there's a lot to take away from this, not only for the state government, but for the nursing homes. Where do we go from here? Because it's clear through this that there's a lot to be learned from this devastation. And just think about that. Over 13,000 people died in nursing homes in New York. It's a significant number of people. When you look at the death toll in New York, you're talking about basically a third of the people who have died in a nursing home. And that's just eye-opening, or at least it should be. And so it's something I will continue to talk about on the podcast. And I think you're going to hear next week, Mark Molinaro did discuss this a little bit during his appearance as well, because we did get into kind of the state response to all this and his thoughts on that as a local government official. But, it's something that will continue to be talked about, along with all of these other lessons from the pandemic, for hospitals, for, just responding to, these outbreaks and is there a better way to do it? So there's a lot of lessons here, and especially with nursing homes, I suspect you'll hear about this, not just for the rest of this year, but well into next year as well. Because look, the pandemic isn't over. The vaccine, and rightfully so, has given a lot of people optimism that the worst is behind us, and in many ways it could be, and it should be, with what we know and the science that we have available to us. But it's also important not just to say, okay, we're past it, time to move on. We have to learn from it, and we have to learn from it as government officials, scientists, the medical field, but also as journalists too. I think there's a lot of takeaways from this for me as a journalist reporting on this, that you look at it and say, yeah, there's stories that I would have told differently, or stories I wish I focused on more, but this was just overwhelming. And there's things that I really wanted to spend a lot of time on, But unfortunately, the pandemic in a lot of ways makes the schedule for you, especially when we saw, especially here in central New York, an uptick in cases. That became the story itself. So, something to keep in mind, and we'll certainly keep that in mind going forward as we cover this, that this isn't over in terms of learning from it. We might get past the point where, you see a lot of these outbreaks and hopefully a lot of people get the vaccine and, the worst is truly behind us. But that doesn't mean that it should be pushed aside and forgotten about. And we say, all right, let's go back to normal. Let's not talk about that anymore. We should talk about that still. And, I think from there, there will be a lot of lessons, a lot of things that need to be implemented. And hopefully, when the next pandemic occurs, we can better protect the most vulnerable in our communities. So with that, I'll wrap it up. You'll hear from me twice next week, as I mentioned, with the 2 podcasts on Wednesday and Friday. After that, we'll get back to a normal Friday slate. Again, just had a backlog to work through, so wanted to get those out as we kick off March. So from here on out, we'll have 1 podcast a week, but enjoy the doubleheader next week. So with that, thanks so much for listening, and I'll talk to you next week.